I am a mom of two boys. I have a teenage son who is age 15, and he threatened to commit suicide in March of 2021. And he has been attending a partial hospitalization program. And it's a intermediate unit. It's a small classroom. It has a psychiatrist that runs it, and along with other mental health professionals. I received a phone call that my son had discussed with another peer potentially wanting to harm himself. I did not feel comfortable calling emergency personnel and having them come to my home because he can have such a fear and it causes so much anxiety for him to have strangers come into our house, to communicate with them, to have them touch him because of his touch sensitivity. So we had a discussion and I chose to drive to the location and put him in my vehicle. I have emergency responder training myself, and I felt confident that he could get into my car. I have child safety locks and I knew he would be safe. And the hospital was not far away. So I had him in my vehicle. We drove to the emergency room. We have a county targeted case manager. The case manager met us at the hospital. So we pulled up, we parked in the parking lot, and my son refused to get out of the vehicle. So the case manager went inside the emergency room where staff had been notified and were waiting for us. However, they said that they were unable to assist us. I do live in a rural area, so they would not come out to the car. They would not they would not discuss anything with me. And they told me to leave and go home and call 911. And it was necessary to have paramedics come to the home and drag him out. I was very frustrated. I was very disappointed that the emergency staff was unwilling to even have a conversation with me about what was happening. And this affected future care as well. So I have been working with the staff at the partial hospitalization program to try to get him more stable so that he is able to attend that program. It's very difficult for me. He is much taller than me. So I am unable to physically get him out the door, even into my car many days. And I feel personally that I have not been supported by the resources in my community. So going forward, I would hope that there would be some emergency medical staff that would, at the hospital, at the emergency room, have the ability to come out, at least have a conversation with me, so that we can document what's happening. It would, I believe the best possible scenario would be to have someone on staff at the emergency room that has the ability to come out, do an emergency evaluation, a crisis evaluation, that they would, if possible, be able to assist in getting my son from the car inside the door. We were just a couple thousand feet from the actual door of the emergency room, and we were turned away. I do have a background, like I said, and so I do know what my son's level of need was at that point. And it was recommended by our primary care physician that emergency personnel come out to the home. However, I was concerned about the trauma that experience might cause for my son, and his ability to trust me or trust care providers in the future. So at this point, I would love to see more emergency staff there at the emergency room that has that ability to assist physically and have communication with me.